Welcome. I am Dr. Patrice Berry. I'm a licensed psychologist, and this was a video that you all requested. I really wanted to take this time and talk to parents of LGBTQ youth. I'm going to be sharing this information at an upcoming parent panel. And so if you see anything on here about Jack and Jill program, or that's what that disclaimer is about. Here's just a little disclaimer. And so during this presentation, I might briefly mention depression or anxiety, any type of severe negative thoughts, because when we're talking about mental health in LGBTQ youth, this is something that often comes up. Grief, loss, abandonment, and any type of negative life events that individuals can go through. So I might briefly mention some of these things listed on the content warning. And then the fact that I'm coming talking about my experience and my work, some people may disagree. And the best thing to do if you disagree with content is to continue scrolling. But some people, if you do find the need to leave a comment, as long as it's done in a respectful way, it will remain. But things that are hurtful, that could be hurtful to this community, I'm very mindful of that, and I do just wanna protect the community if with certain things that are said. There are other places to have a more open discussion. I wanna make sure that this discussion stays safe, which is why I pre-recorded this as well. So here is a graphic, and I want to make it bigger. So let's start out with talking about gender identity. And this gender unicorn is something that I often use to just kind of explain and give a visual for these different ways to talk and describe these different elements of an individual's identity. So we start with gender identity, that anywhere on that spectrum that an individual can identify as female, and then at the other end of that spectrum we have male, and then within that spectrum there are other genders, so they them, there are other pronouns that individuals might use. And this has been a bit of a generation. So I work with some people whose parents are older than me, that are the same age as me. And some people have difficulty with this concept. And I think I saw on social media somebody talked about, so if I was describing a friend to you, and I might just say, "Hey, oh yeah, and they said this." So using neutral pronouns is something that we do naturally. And because some people will get really stuck on certain pronouns, or they'll get stuck on identity and all those things. And so that's where gender identity, this is the spectrum for that. Gender expression is another spectrum, that on one end we have a very feminine expression, on another end we might have a very masculine expression. And so an individual can have a female gender identity, have a male gender expression, but their identity, so because expression is what they're wearing, how they present, how they look, but identity is who they are, and that those two things are different. So, because sometimes I'll have an individual, I'll be working with a trans male who the family's confused that sometimes they might wear a dress, or that sometimes, and they think the individual is confused, but gender expression and identity are two different things. And often we put males, because of how stereotypical or how just heteronormative our society is, that we think, okay, girls wear dresses, boys wear this. And by having these very strict boxes, it does make things a little bit more complex. And another great example of the difference between gender identity and gender expression is that there could be an individual that is a gay male that loves doing drag, and dressing, doing a gender expression that's more feminine is something that they enjoy, but they do not identify as female. They identify as male. And that would be just another example. And these things can get incredibly confusing. And this is specifically being made to talk to parents. and getting a better understanding of this on your own. So, not expecting your child to teach you all of these things or to go through all these things, or mom, like to not have your child explain this. This is why I really wanted to create this video and put this information out there so that if an individual does have a child, this could just be just some basic information. This can be a starting point where somebody can deepen their understanding of these topics. Then we have sex assigned as at birth, which is female, male, or intersex, because some individuals are born with both male and female parts and are intersex. And sometimes in the past, the physician would sometimes have the parent choose. What many parents do is they let the child get older and then they let the child make the decision of which gender do they identify with, and they end up having that conversation later. There have been situations that I've heard of. I believe there was a documentary. I forget if it was on Amazon, Hulu. I forget exactly which place this was, but it was talking about gender, and that an individual, they found out that they were intersex and the parents decided on a particular gender. And as the person got older, they just felt like they were in the wrong body, that they whatever the gender, I don't remember exactly what it was, whatever the gender the parents picked, that wasn't how the child identified, and later ended up transitioning to the one that was more consistent. And they found out this information, they were actually born intersex. So then we get down to who someone is physically attracted to. Who do they want to be romantically involved with? Do they want to be involved with women? Do they want to be involved with men? Or are they, is because that can be a spectrum, or are they bisexual? Are they asexual? There are all of these different, there's a bit of a spectrum with that. So an individual can have identify as a female. The gender expression might be masculine, and then they might be attracted to women. And some individuals will use the word queer to describe their identity. And a recent example of this is with Jody Hildebrandt's niece, Jessie. They talked about being queer and that that was their identity. And I think it was because of their they them their pronouns and how they identify. They most related to the term queer. And the individual is the one that gets to pick that. So I don't get to put that on somebody else. I don't say, oh, well, you like this. And so then you're this. So that's not something that you're told. That's something that someone identifies. That's something that they end up coming out and expressing. And then who is an individual emotionally attracted to? Women, men, neither. And so this one just goes further for that. And emotional attraction doesn't mean intimate attraction. So this is just, which I hope it doesn't make it more confusing, but this is how this particular graphic explains things. There is also the genderbread person. And this is a similar thing where we talk about gender identity on that spectrum. We talk about gender expression. So identity is kind of how I am in my head. Attraction is where I am in my heart. Biological sex, and then who an individual is sexually or romantically attracted to. And so that's how this one breaks it down. Now, with some definitions. So there is an acronym, LGBTQIA+, and that stands for lesbian, gay, bisexual, transgender, queer, questioning, intersex, and asexual. And each one of those has, I don't know about the questioning, but I know that there are different flags that are associated. I have my flags. Let me grab those. So the one that we commonly see is just kind of the LGBTQ, just kind of the rainbow flag. And then there is a trans flag. And then that each different, I'm almost positive this is bisexual, Sometimes and so there are different flags that have a different orientation. Okay. And I have these in my office just as a sign to an individual that maybe is going to come out, or that just that I'm a safe space, that an individual that is LGBTQ, that they are able to express themselves in my office and find safety. I do work with kids and teens, and sometimes the hard thing for parents is the fact that therapy gets to be a safe place for them, and that as a therapist, I won't share everything. So if a child comes out to me, or especially teen, so in Virginia, legally, it's 12 and up. They have additional, I don't think it's called confidentiality, but they have additional privilege where some things don't have to be shared with the parent, and the child has to assent to treatment. The child has to agree to be there. That parents can't force the child to participate in sessions. So when I'm working with kids that are 12 and older, they have to agree to be in the session, to participate. I do my best to make all kiddos that I work with, for everyone that I work with, to make the session about them, and that even if a parent is encouraging them to be there, that while they're there, that they work on the things that they want to work on, that we are making their life more, a better, that we're making it better, and we're working on whatever goals they have. But I have had some individuals come out to me, and then we talked about them being able to come out to their family. Was that possible? Was that a safe thing? And them just kind of being able to express those things. I never push an individual one way or the other. And I think that's important for parents to know, because I do think that sometimes there is this thing of, oh, is the school pressuring, or is the therapist going to pressure? Because I've sometimes had families or parents ask, okay, I think my kid is questioning their identity, and they might need to talk with a therapist about it. And if I was going to do that for my own kiddo, I would just want to know, okay, so what's your approach? And working with LGBTQ youth, what what's your approach with someone that's questioning, or with somebody that is bisexual, or what is your approach? For me, what I do is I am just so I don't guide or lead anyone in any particular way. So as a therapist, I don't really give advice. There are rare situations about safety where I'm like, okay, I don't like, but I'm gonna tell you my true thoughts. I'm gonna tell you what I think, because I this is about safety. Or I have with some discipline things, or with some parenting techniques, especially for adoptive and foster youth. I will give very specific recommendations, but in general, I'm a very client-centered, client-oriented, where I'm just the support and the client is the one that's guiding treatment. That's how I typically operate. But as a parent, I think it's good for you to know just kind of what's the approach that's taken. I'd also want to know, like, does the individual work with LGBTQ youth? Because the things that we know are detrimental to individuals' health are the pray the gay away, or conversion therapy. Those types of things are very damaging. I went to a Christian graduate school where I learned how to ethically integrate faith into treatment. And even at that school, I learned, I hate to say even, but I am going to say we learned how to ethically support and work with. And I did additional training after that, because we did some, but I didn't get everything that I was looking for in as far as working with LGBTQ youth. And there's been a lot of growth and development. So when I was in grad school, I think it was mostly, from what I can remember, the main acronym was probably LGBTQ. That was the main one that I was aware of. There were some parts of the community where I was not aware of certain things. I am heterosexual, cisgender. So cisgender means my sex assigned at birth, and my gender, how I identify, my gender identity, that those are the same. How I present is the same with the body that I was born into. And for different individuals, transitioning, all these things looks different for each person. And most medical doctors, they are not going to take extreme risk with children, that they're going to do this in a safe way, and not providing children with gender affirming care can lead to detrimental, like, serious, I'm trying to not get in trouble on the tube, but it can cause individuals to have increased depression, anxiety, and those dark thoughts that make it hard for people to remain here on the planet. So a lot of my LGBTQ youth struggle with those types of really dark thoughts, and that living in a cisgender heterosexual world with all of these norms and all these expectations, that for some people that can be incredibly painful. And so finding safe communities, safe ways, safe spaces for them to express that can literally save their life. And I also support my clients, especially the adults, um, individuals who now they're 18, they're 19, they're 20 years old, or they're older than that. And if they want to look at what transition options are available, that they discuss those things with their medical doctor, that they consider it for themselves. So these things require psychological clearance. So similar to an individual that's referred for bariatric surgery, that they have to get a psychological eval just to confirm that the individual doesn't have body dysmorphia, where they're seeing their body where they're never going to be satisfied with the results, and there's a psychological reason why the individual would not be a good candidate for that type of medical procedure. Similar clearance is needed for any type of gender affirming therapy. So I think that's just good for people to know. So, with some of the other definitions, transgender woman is an individual who identifies as a woman and was not assigned this gender or sex at birth. Transgender man, an individual who identifies as a man but was not assigned this gender or sex at birth. Female to male, uh, it talks about a transgender person that transitions from female to male and then male to female. Relatively outdated term to refer to a male to female transgender person that transitions. I included these outdated terms just because some people still hear these things, but I just wanted to include those. And then also sex assigned at birth. Because this is a video talking to parents, I think I don't want to underestimate. So it is incredibly important that LGBTQ youth have the support of their parents and families if those can be safe and supportive people. 24% of individuals that are LGBTQ feel like they can be themselves at home. So 25% of families show support and get involved in the LGBTQ community. 67% of families make negative comments about LGBTQ people. And so that's where you just want to be careful of language and things that you say, and have safe and like address any homophobia, just any of those obias and isms, that because sometimes it's just in the little comments that people make or the things that people assume. Something that I do as a parent raising a child is I will sometimes not use my child's gender. So I will sometimes refer to them, and I might not say him, or because if one day my child came to me and if their gender, if their preferred name, if it was different from the one that they were born with, as a parent, I wanna be able to support my child, and that can be incredibly hard, and the parent has to grieve that, but that's not on the child, so the parent needs to grieve that privately. So a big point of contention is feeling like the parent is losing. So for me, it would be losing my son to now embrace my daughter, if that was something that my child came to me later and said. And that grief associated with all the things that they thought their child was going to be. And this can happen not just for parents of trans youth. This also happens for if my child comes out as, so I don't imagine who my child might marry. Or if I do imagine it, I try to have an open mind because you never know. But if I have this plan, if I have this thought, if I'm living in this way, I'm setting myself up to possibly not manage. If my child ever came to me and gave me information that was different from what I had imagined for him, he might know it, he might see it, he might feel it and sense it. And so as a parent, that's just something that I try to do, to be able to support and be there from my child. And then 48% of families make the youth feel negative about being LGBTQ. Okay. And then, so now let's also talk about LGBTQ youth that wanted mental health care but were unable to get it. And these were the top 10 reasons that they cited: fear of discussing mental health concerns, and that's why I talk about mental health, breaking mental health stigma here, because there can be a lot of fear, there can be a lot of stigma associated with mental health. And we know based on research, LGBTQ youth often experience mental health issues at a higher rate than their heteronormative peers, or it's just the thing. Their cisgender peers. And the way that I see it is they are part of a marginalized group, and individuals that are in marginalized groups, they need to find their safety, they need to find community. They're going to experience things that are different. So, concerns with obtaining parent or caregiver permission. So that's where sometimes I talk with youth about the safe spaces that can be there for them. If they are in school, but there are some places that aren't going to be safe anymore because there are some states that have passed laws where if a child discloses something about their gender or sexual orientation at school, that the teacher is required to tell the parent, which then makes that environment no longer safe for that student. And that student is going to keep it to themselves, and they're not going to get the help and support that they may need. Fear of not being taken seriously. Therapy can be expensive, so lack of affordability, fear of care or therapy not working, and so finding a good provider, fear of being outed by the therapist. And so that's where I've had people kind of test the waters to be like, hey, what would you have to tell my parents? Or and I have held that in confidence. If there were people that during our treatment, during our time, they weren't at a place where they felt comfortable and safe enough to come out to family members. Sometimes they did find a family member, but maybe it wasn't their parent. They did come out to someone in their family. And the more people they tell, the more chances of them possibly being outed. But I just let them know that it's not going to be me, and that I use the pronouns, I use whatever language they want in session, but then out in public that we use whatever the agreed upon terms or language with them. Concerns with receiving virtual care at home, that somebody might be listening in, or that somehow that might not be as confidential. Lack of transportation options if they're looking for in person options, and then lack of parent or caregiver permission. So, and then I want to specifically talk about LGBTQ youth of color, because they have higher risk of attempts than their same age, than their counterparts, specifically for Black, Latino, and Native and Indigenous individuals. And some of that can be cultural. So sometimes within some cultures, there are certain norms, there are certain understandings and beliefs that are held. And sometimes that can be spiritual or religious, and that really can be a multifaceted number there. So there are lots of prevention and resources out there. 988 is a crisis number. I have heard positive and negative things about that one. There is the Trevor Project, and that was created by a mom whose child died by depression. And they started this foundation to create a safe space for kids and teens, so that they could have that. And so that's where I like to share these resources, and there are many more if you just search for any of these types of things. Sometimes I have clients that are at risk of self harm, and they have like a calm harm app, or they find different apps or different things that help them in the moment. So for this presentation, because parents sometimes they don't take care of themselves. And this video is specific to parents. And so I did want to say that helpers need help too, that the parent has to put their mask on first in order to be there for their parent, and in order to be there for their child. They have to be in a place emotionally, physically, that you have I've had some people have to come to therapy to talk about the grief that they were feeling about their child coming out to them, but going to their child about it wouldn't have been appropriate. So our children, no matter how old they are, that I'm the parent. I'm always supposed to be bigger, stronger, like that I'm supposed to be the one that my child can come to. And then if I need someone, that's where I have a partner, I have other supports. I have my therapist, I have other people that can help support me when I need that I don't go to my child for that, because then it messes with the parent-child dynamic, where then the child can think, "My issue's too big. If my parent can't handle this little thing, how are they gonna be able to handle this other thing?" And so I always wanna be that place, and then also create safe spaces for my child as well. I joke, but I'm being serious. My child, he hasn't had his first regular therapist yet. We do speech therapy, and he will. He will have, because I value mental health treatment for all kiddos, for all people, that the same way I take my child every year for a physical, that getting a mental checkup, taking him to a psychologist or licensed counselor, that will be a part of his normal health care as well. Besides looking at only the physical. Some pediatricians will screen for anxiety, depression, things like that, because we are seeing increasing numbers of depression, anxiety, and I think death by that word. I think it's like the number 1 or 2 cause of death, individuals 8 to 23, I think. I'll have to look up that number later. But, we really do have to make sure that we're taking care of our mental health so that we can be in a better place to be there and support our kiddos emotionally. So this was actually a picture that I included for a different training, but what it is I can't reason with somebody that's dysregulated. So if my child is dysregulated, or if I'm dysregulated, what I first have to do is regulate. So I have to regulate myself first. So hearing information that I wasn't prepared for, it can send your brain into a stress response. Fight, flight, freeze, that it can send you into an automatic stress response where you react instead of respond. I want to respond to my child out of my thinking brain and not my emotional amygdala. So I want to first regulate myself. I use my breath a lot to regulate. I step away from situations. Those are things that work for me. Each individual, and depending on the situation, something different. So sometimes to regulate, I might need to cry. I might need to go for a walk, like depending on the situations. So the size of the solution has to fit the size of the problem. So if I just got the worst news ever, deep breathing is not going to work. I might need to just cry. I might need to go hug someone. I might need some physical comfort versus, if I bump my toe against something, and that hurts, I'm breathing, it's fine. That might be enough to get through that situation. So I first have to regulate. Second, we relate and connect. So before you talk and try to understand, you first thank you so much for telling me. I'm so glad that you had like, because it takes a lot for an individual to come out and share that information. And then also some people are questioning. And so know of a situation where an individual was being pressured by their friend group. And this is a family member of mine. So this isn't a client or anything. A family member of mine felt pressure from a friend group to have a certain gender expression, gender identity. And it turned out that that was not how they truly felt. Like it was really this friend group, and they made the decision to come away from that friend group. And but the parent was supportive of them. Okay, you pronouns he him, okay. And the parent was extremely supportive of them throughout it. And the child found their way, and it wasn't that it was just a stage or that they were it was just in that situation they were finding themselves. And along the way, something that kind of happens now is sometimes people are like, okay, well, what are my preferred pronouns? So that was something that I never questioned, but I never had the opportunity to. And so I don't know if I ever would have. I know growing up for me personally, so I have a very muscular build naturally. I have a deeper voice just naturally. So there are things I used to get teased. I think the boys were jealous because I could build muscle very, very easily. And they would be in the gym all day, not a muscle in sight. I looked at a weight and I would like build muscle. Like it was just I appreciate it now. As a teenage girl, that was it caused that's for me and my therapist. But in those situations, sometimes an individual is in a difficult space, but telling a child. So I'll give y'all a tip that I've learned along the way, that once kids are about 12 years old, we become more of a coach. I'm still the parent, but I'm more coaching them along the way versus when my child before the age of 12. So like this morning I had my child wear his jacket because we're in Virginia, the weather's changed. This morning it was in the 40s, and so I had him wear his winter coat. If he was 16 years old and he wanted to make the choice to go outside in a short sleeve shirt and be cold, like it's like, hey, I recommend you get your jacket. I'm not getting that jacket. Okay, have a good day. Like, please don't talk to me that way if I'm gonna redirect that link, how he was talking to me. But I wouldn't force my 16-year-old who's like cognitive. So like there's no cognitive delay, there's no major issue. I wouldn't force him to wear a jacket if he chose to not wear a jacket. But for my 6-year-old, like I'm still mom. And we did it's like, do you want this jacket or this jacket? Sometimes giving choice can kind of help, but that's how we manage things. And then last, we can support children reflect, learning, remembering. And this was more so the three R's was how to talk to a person's learning brain. So that thinking brain or that learning brain, we first have to calm that amygdala. That's what we have to do first. That fight or flight response. And as the adult, I have to regulate myself first. I can't expect my child to be calm and I'm screaming and yelling at them. I have to be the calm one first. So, here are some tips that when I have my child come to me, and I wish all kids just knew that they are loved, just how loved and appreciated they are. For many LGBTQ youth, breaking the news to their parents can be really scary. And so often I will hear them talk about not being sure if their parents can handle it, how they'll react, will they be kicked out? That often they have a lot of fears that come up. And research has shown that LGBTQ adolescents that are supported by families grow up to be happier and healthier adults. And so making sure to provide that support. I'm here for you. I love you. I support you no matter what. That language can be really important. I want to encourage dialogue if I can. So if my child is in a place to talk, I want to make sure to have those conversations. I want to make sure that they're being safe, that they're using good decisions and good judgment in different situations, and then giving them education if it's needed. If they are making risky decisions, I want to make sure um, that I figure out how to talk to them. So there are things we do that can make it harder. So asking why. Mm. So why questions bring up it brings up defenses where a person is trying to defend themselves. So why did you do this? Versus help me understand. So what was going on? When did you first kind of think this? And so with gender identity, so we can sometimes see as early as 2 or 3 or 4 young kids talking about with more the traditional. So like if I'm thinking of a very classic way that gender identity can sometimes so within my DSM-4, I haven't looked at the DSM-5, that particular, because I think they might have, I forget if they removed gender dysphoria or gender dysphoria. They clarify that just because the individual is trans, it doesn't mean that they do have gender dysphoria if they are expressing themselves the way they want, that's not an automatic thing. And but there are classic presentations of a 4-year-old boy talking about wanting to cut things off because they just want to be a girl. And like there are these classic expressions in very, very young children that weren't like they didn't see it on TV. Because sometimes there are all these myths of like, what causes these things? Is it because of this or is it because of that? And honestly, I think that people are freer to kind of express these things and explore these things. And because I remember growing up with "Don't ask, don't tell," in the military, and talking to individuals that have been impacted by some of those policies, and where it was like, okay, it's okay to be you, but just like don't talk about it. And now we're in a very more of an open culture. It's still very heteronormative and cisgender. Like that's just there's still a lot of homophobia and transphobia, all those things. Often people get concerned about bathrooms and people. Uh, so I just saw a story the other day of a social worker, that female social worker, probably heterosexual, cisgender, that had offended a 13-year-old boy. And the courage that individual had to have to come forward and report this, or you hear of teachers doing inappropriate things, and it's in a more heterosexual way. Like, because I think sometimes there's still this stigma that individuals that identify a certain way, that they are somehow deviant or they're somehow out to harm other people. And the research just so there are people of any gender identity or gender expression that we need to watch out for, we need to report, they need consequences for, like there are people out there that don't have good boundaries. Having restrictions on bathrooms, it's just, so often the individuals that I work with, they often prefer to use the neutral bathroom, because sometimes individuals that are trans, they are more likely to be bullied, they're more likely to have to be victims by people, just that homophobia and just all those hideous kind of ways that people think about and pathologize something that I don't think has to be pathologized. Those are just my thoughts. So it was a big deal for me to allow my 6-year-old son to go into the bathroom by himself, like without his dad, to go into the boys' bathroom. So, because I normally brought him into the women's bathroom with me. And we were at a store. He really wanted to use a urinal. So I peeked in. Nobody was in there. I let him go in. I stood at the door to like watch, because it's my, yeah, that's my child. I just wanted to make sure everything was okay. He washed it. He's good about washing his hands, but and I understand people's concerns. I'll leave that there. And so something that I do personally to just allow my child to express himself the way that he wants to. So my kiddo, sometimes he likes to paint his nails with nail polish. And so we don't have a rule like where nail polish is a girl thing. It's like, oh, you want to paint your nails? Sure. So he gets to paint his nails. He gravitates more to the traditional things that we would consider to be more kind of boy things. And he also likes some things that are considered to be more, what we would consider girl things. I think it's good to have all kids play with food and play different things. We often socialize girls in certain ways, and we can socialize boys in certain ways. And we can have these beliefs and ideas about girls and boys that are not appropriate. So like boys don't cry. No, like boys should be able to cry. Boys should be able to emote. Boys should be able to have feelings. Crying doesn't make you a sissy, or it doesn't mean there's something wrong with you. Because sometimes what we'll do is we'll only allow boys to have anger and to fight. But if they're sad, and they might show it by being aggressive. And so we want to make sure that we give them a more well-rounded ability. We want to make sure that we give them the ability to be well-rounded and socially and emotionally mature individuals. So I'll say that. Some signs of bullying are behavioral change, issues at school, declining grades. So all of a sudden not wanting to go to school, having unexcused absences, sudden shifts in who they are friends with or who they're not friends with, and then engaging in increased risky behaviors. Make sure to stay on top of their social media. That is all really important. I received some of these tips were from the hopkinsmedicine.org. I truly hope that this was helpful and can be a resource to individuals. If you do have questions, if you would like for me to dive into something a little deeper, please let me know in the comments. Thank you to the individual that asked this question and asked for this specific video. I hope you enjoy the rest of your day.